well done for doing your infection control. Yes. I also supplied you as well with the wipes, which you have used, I'm sure, for cleaning up your mannequins. And then, so now we are doing the anaphylaxis. So what is anaphylaxis? Would you just say in your own words, what do you think anaphylaxis is?
It's a life-threatening situation in regards to an allergy.
Yes. So, and I can see you are holding your, yeah. So we would use this EpiPen. We want to see you demonstrate use of the EpiPen. So what do we check on the EpiPen before we even use it?
So we make sure it's intact and it's not damaged. It's not, no seals are broken.
Yes.
Once we do that, we'll in the situation that
yeah, something else that we check on there with any medication we check. What else?
Check the
expiry date. Yes, that's correct. So, and so it's not expired, it's intact, as you said, it hasn't been used, it's not out of date. Now, you can either choose, there's no medication in here, it's just a training one. And if you didn't do it correct, if you use it, so say I'm just giving an example on myself. If I used it, if you use it and I said to you, do it again. So if I used it like that, because it's a training one, there's no medication, you can pinch here and push it back and then you can use it again. So it depends. If you don't do it correct and I say do it again, that's how you do it. Okay. So before you use it, before you use it, what do you check on the person?
So you'd look for any signs, symptoms, see if they've got any rashes or anything like that.
Yeah, that we have already done, but you want, okay, so where do you want to put it, on the thigh?
I want to put it on mid-thigh.
Yeah, so before we use it, what can we check on that person before we just go in?
There's nothing on the area.
Yeah, there's nothing in their pockets. Because if there's something in the pocket, the EpiPen is going to go in the phone or on the keys. So it's not going to help that person. So we check their pockets and make sure there's nothing on there. And as we always say, to make sure, blue to the sky, orange to the thigh. And always make a fist in the middle of the EpiPen. Because some people, because they are used to giving injections, they tend to want to put their thumb on there. That's wrong, because otherwise you get yourself pricked. So all fingers tight around there. And then people tend to throw the thing. You don't have to throw the thing. You just press, click, count 2001, 2002, 2003. Why do you think we count?
We need it to hold it there for 3 seconds.
Why?
So the medication gets into the body.
Exactly. Because if we just go and out, it goes into the air because it is still coming, it's still delivering. So that's correct, Zoe. Okay, so now you are going to demonstrate for me giving the EpiPen. Go ahead.
So lifting up the blue part, tightening my arm, finding the mid-thigh.
Oh, that was, you were almost 100%, but do you know what you did?
I didn't hold it in.
Number one, you didn't hold it in place. Number two, you threw it. So remember, we said we are not throwing. We said
we're not trying.
We're not playing darts. So we just so we are just putting it to the body, and then we are pressing, and
holding it in place.
Yes.
Pressing it. 1, 2, 3. Release.
And that's correct. That's better now, because that was just okay. That's correct now, Zoe. Thank you. Okay, so that one is done. That's good. Well done. I'll tick you for that one. Then the next one now for you, Zoe, is the asthma.